My name is Desiree Tumbaga, and for my rehab project, I've decided to do rehab on open reduction and internal fixation rib fractures. For starters, let's learn about the anatomy of the ribs. There are 5 parts of the ribs: the head, which connects to the spine; the neck, which is a narrow area of the head; tubercle, which is a bump that connects to the spine and the ligaments; the body is a long curved part of the rib; and the angle, which is an area where the rib curves sharply. Inferior to the ribs, we have the costal groove, which is a small groove underneath for nerves and blood vessels. The ribs protect some of the most important parts of the body, including the heart, lungs, blood vessels, liver, spleen, and kidney. When a rib fracture is in place, these body parts are at risk. When you have an upper rib fracture, large blood vessels are at risk because they bring blood to and from the heart. As for a lower rib fracture, the liver, kidney, and spleen are at risk. A rib fracture can occur by direct trauma, such as car crashes, falling off a great height or onto a hard surface, or even in contact sports. Severe coughing, especially in older adults or those with osteoporosis, weak bones, repetitive stress or force on the ribs, such as an athlete that row, golf, or weightlift. Cancer, which can lead to bones weakening, and direct compression, like being pressed between heavy objects or even when given CPR. Protective measures like wearing seatbelts, proper sports gear, and maintaining bone health can help reduce the risk of rib fractures. Some symptoms of rib fractures can include pain while breathing deeply, moving your torso, coughing, sneezing, and laughing, difficulty breathing, swelling, and bruising around the fracture, tenderness, deformity, crepitus, which is a cracking or popping sound, and even coughing up blood, which is a sign of a lung puncture. There are 5 different surgeries of the rib, those include ORIF, which stands for open reduction and internal fixation, which I will be focusing more on. Then we have minimally invasive rib plating, which is where a small incision is made near the fractured rib. The surgeon then repositions the fracture in segments and places a titanium or biocompatible plate to match the shape of the ribs. These plates are secured to the rib using screws or locking mechanisms to stabilize the fracture. Once those plates are secured, the incision is closed. Thoracoscopic surgery is a surgery done where small incisions are made and a camera is inserted the chest cavity. They use specialized tools to reposition and stabilize the fractured rib with plates or screws. When the instruments are removed, the incisions are closed. The next surgery is intramedullary fixation, where small incisions are made near the fractured rib, and a guide wire is inserted to the medullary canal of the fractured rib. Titanium or a polymer rod is inserted to stabilize the rib and maintaining alignment. Then the incisions are closed. Lastly, we have reconstructive surgery for the ribs, where incisions are made to expose the affected ribs and chest wall of the damaged ribs, are stabilized with plates, screws, or even intramedullary rods. In some cases of severe loss, rib segments may be replaced with synthetic materials or autologous grafts, which are bone or cartilage from the patient. This is then closed, and a chest drain may be placed to prevent fluid buildup. Let's get into our main focus, which is open reduction and internal fixation, which is the most common surgeries to get. For this surgery, the patient undergoes imaging, which includes x-rays or a CT scan to evaluate where the fracture is located. Then a surgical incision is made to access the fractured bone fragments. These are then reduced to restore to their natural positions. Plates, screws, or rods are attached to the bone to stabilize the fracture and hold it in place during healing. Then the incision is closed. Phase 1 of the rehab is 0 to 4 weeks. The goals we have during this phase is pain management, preventing any complications, and to protect the healing fractured rib. Since this is a rib fracture, we are going to be doing some breathing exercises like diaphragmatic breathing and incentive spirometry. Diaphragmatic breathing is where you inhale while your stomach is out and exhale while your belly is in. Incentive spirometry is where you exhale or inhale into a tube and hold to show where you are. For some actual exercises, we have shoulder pendulum, where you lean forward and rock your arm back and forth. Elbow flexion and extension, postural corrections. Once these are accomplished, we can move on to phase 2, which is 4 to 8 weeks. Our goals are to increase mobility, strengthen breathing muscles, and gradually increase activity. For our breathing exercises, we have pursed breathing, which is where you inhale through the nose and exhale through the mouth. Shoulder flexion, where you move your arm up and below. Chest stretch, where you have your arms behind and pull. Pelvic tilts, where you lay down and move your pelvic up and down. We also do bridges, seated marching, and even standing or supported walks. Once able to do all of that, we have our third phase, which is 8 to 12 weeks. The goals during this is to improve strength and gradually return to normal activities. We have advanced diaphragmatic breathing, wall push-ups, resistant band exercises, along with modified planks, side-laying leg lifts, and step-ups. For our last phase 4, which is 3 to 6 months, our goals are to return to normal activity and prevent any reoccurrence. We will do some coordinated breathing during any functional task, which include going upstairs, opening jars, or even bending down. Once that's easy, we will be able to breathe with endurance activities, starting at a slow jog to a run. At this stage, we will be able to do full push-ups, shoulder press with weight, standing oblique twist, standing on one leg, and lastly, cycling. Thank you.